According to the Global Burden of Disease study in 2019, diet-related risks are responsible for about 20 to 25% of deaths worldwide, making poor diet the leading behavioral risk factor globally. But in the United States, the number is almost double. The Center for Disease Control and Prevention, or CDC, reports that poor diet and physical inactivity contribute to roughly 45% of all deaths in the US. This problem demands our attention because, unlike many other countries, the US lacks sufficient regulation to address those diet-related health risks, and without government intervention, this trend will continue to worsen. First, we'll look at the direct health consequences of poor diet. Second, we'll examine how other countries have successfully implemented food regulations. And finally, we'll explore the economic costs of poor nutrition and how regulation could alleviate them. One of the biggest concerns today is how eating unhealthy foods leads to serious health problems like obesity, diabetes, heart disease, and other chronic illnesses. Right now, obesity rates are rising at an alarming rate, with over 40% of American adults classified as obese according to the CDC. This means millions are facing the harmful effects of poor diets. A large part of the problem comes from processed foods that are packed with sugar, unhealthy fats, and too much salt. These types of foods are especially common in low-income communities where healthy options are often hard to find. If the government took steps to limit harmful ingredients or control portion sizes, it could help prevent many of these chronic diseases before they even begin. According to the 2019 Global Burden of Disease study, poor nutrition is linked to the most common chronic diseases in the US, including obesity, heart disease, stroke, type 2 diabetes, and even certain cancers. These illnesses not only shorten lives, but also lower the quality of life for millions each year. This evidence clearly shows why the US government needs to step in and take action to improve the health of Americans. Luckily, there are proven examples from around the world showing that government policies can make a difference. Countries like Mexico, the UK, Chile, and Finland have introduced taxes on sugary drinks and junk food, mandatory warning labels, and advertising restrictions. In Mexico, after implementing a soda tax in 2014, a comprehensive study published in Health Affairs found a 7 to 12% decrease in soda purchases within just 2 years. Similarly, the UK's sugar tax introduced in 2018 led many manufacturers to reformulate their products, reducing sugar content significantly and dropping sugary drink sales by 10 to 15%, according to Public Health England, an executive agency of the Department of Health and Social Care in England. Chile's strict labeling laws, with black stop sign warnings and bans on junk food advertising to children, have also lowered unhealthy snack purchases and increased public awareness. Finally, Finland's long-term taxes on saturated fat and sugar, combined with strong public health campaigns, contributed to steady declines in obesity and heart disease rates since 1972, as stated in the European Journal of Public Health. These examples demonstrate that government regulation can effectively reduce consumption of unhealthy foods, making a real impact on public health. Beyond personal health, poor nutrition carries a huge economic cost. The rise of diet-related diseases puts a massive strain on the healthcare system, costing billions in treatment and lost productivity. According to recent research from the American Ashton Forum, a data-driven think tank that focuses on economic and fiscal policy, the U.S. economy loses an estimated $6.1 trillion annually due to nutrition-related chronic diseases, considering factors like reduced wages, higher employment costs, and decreased government revenue. If the government implemented regulations such as taxes on sugary drinks or restrictions on harmful additives, it could lessen this financial burden. Reduced rates of obesity and chronic disease would mean fewer hospital visits, lower medical expenses, and a healthier workforce contributing more effectively to the economy. In conclusion, poor diet is a leading cause of preventable death and disease in the U.S. with devastating health and economic consequences. Nearly half of all deaths in the country are linked to diet and inactivity, a crisis we can no longer afford to ignore. But it doesn't have to be this way. Evidence from other countries shows that government actions such as taxes on unhealthy foods, warning labels, and advertising restrictions can significantly reduce harmful consumption and improve public health. By implementing reasonable, science-based regulations, the U.S. has a clear opportunity to improve health outcomes, save lives, and ease the growing economic burden on society. The time to act is now. The health of millions depends on it. Thank you.